The job description of a personal care assistant, PCA, focuses on delivering hands-on support to individuals who need help with daily living activities due to age, illness, disability, or recovery from medical procedures. Personal care assistants typically work in private homes, assisted living facilities, nursing homes, or community-based settings. Their primary role is to help clients maintain as much independence and comfort as possible, while ensuring their safety and well-being through compassionate, consistent care. A personal care assistant's duties go far beyond basic support. They often form close, trusting relationships with those they care for. Their work requires sensitivity, discretion, and adaptability, especially when assisting clients with deeply personal tasks. Depending on the client's condition, a PCA might be responsible for helping with personal hygiene, dressing, mobility, medication reminders, meal preparation, and light housekeeping. The type and level of assistance required can vary from client to client, but the core focus is always on improving quality of life. In many cases, personal care assistants are the client's primary day-to-day contact and emotional anchor. This role requires not just physical support, but emotional attentiveness and mental engagement. While they are not licensed to provide clinical health care, PCAs serve as the eyes and ears of family members and healthcare professionals, often noticing subtle changes in a client's behavior, mood, or condition that can prompt timely medical intervention. Primary responsibilities of a personal care assistant. The first and most visible responsibility of a personal care assistant is to help clients perform activities of daily living, ADLs. This includes assisting with bathing, grooming, toileting, dressing, and oral hygiene. These tasks require a high level of trust and professionalism, as PCAs must maintain their clients' dignity while providing essential physical help. For clients with limited mobility, PCAs may need to help with transferring between beds and chairs or support walking to reduce the risk of falls. Meal preparation is another key aspect of the PCA's responsibilities. Personal care assistants may be required to plan meals according to specific dietary restrictions, assist with feeding, and monitor fluid intake. For elderly clients or those with chronic illnesses, proper nutrition is crucial to maintaining health and energy levels. PCAs often shop for groceries and ensure food is stored safely and prepared in accordance with hygiene standards. Medication support is also part of the PCA's role. While they typically do not administer medications directly unless trained and permitted, PCAs often provide reminders and ensure that clients take their prescriptions as scheduled. They may also help open pill bottles or read labels for clients with vision impairment, keeping track of timing and dosage to ensure compliance. In addition to health-related tasks, personal care assistants are often expected to perform light housekeeping duties. This can include tidying rooms, making beds, doing laundry, washing dishes, and disinfecting frequently used surfaces. Keeping a client's environment clean and organized contributes significantly to both physical and mental wellness. Mobility support is another critical area. PCAs assist with walking, using wheelchairs, and performing range of motion exercises, particularly in clients who are recovering from surgery or managing long-term conditions such as arthritis or stroke. Some PCAs also provide transportation or accompany clients to medical appointments, grocery stores, or community centers, offering companionship as well as logistical support. Importantly, PCAs offer emotional and social support. Many clients live alone and may be isolated, so personal care assistants often become an essential source of human connection. Whether through conversation, reading together, playing games, or simply being present, PCAs help clients feel valued and engaged in daily life. Midway through this exploration of duties, it's clear that the job description of a personal care assistant extends well beyond physical tasks. It involves emotional intelligence, attention to detail, and a sincere commitment to improving someone else's day every single day. Required skills and personal attributes. To succeed as a personal care assistant, a compassionate and patient nature is absolutely essential. PCAs must demonstrate empathy and understanding, especially when working with clients facing cognitive challenges, chronic illness, or emotional distress. A calm, steady demeanor helps to create a safe and supportive environment. Communication skills, both verbal and nonverbal, are vital. PCAs need to listen attentively to client needs, follow instructions carefully, and relay observations clearly to family members, nurses, or supervisors. In cases involving memory loss or hearing difficulties, communication must also be adjusted for clarity and effectiveness. Physical stamina is important due to the physically demanding nature of the work. PCAs spend a lot of time on their feet, and tasks such as lifting or repositioning clients require strength and proper technique. Employers often provide training in safe lifting practices to reduce the risk of injury. Reliability and trustworthiness are also key qualities. Clients and their families rely heavily on the personal care assistant's punctuality, consistency, and discretion. PCAs are frequently responsible for managing keys to a home, confidential information, and the intimate aspects of someone's life, which requires a strong moral compass and respect for privacy. Flexibility and adaptability are valuable traits, as no 2 days or clients are exactly alike. A PCA might be helping an energetic senior stay active one day and providing comfort to a bedridden client the next. The ability to shift approaches based on individual client preferences and conditions is what separates competent PCAs from exceptional ones. Work environment and challenges. The working environment of a personal care assistant is typically non-clinical and centered around home or residential settings. However, the job is not without its challenges. PCAs often work irregular hours, including nights, weekends, or holidays, based on client needs. Emergency call-ins and split shifts are also common in live-in or on-call roles. Working with clients who suffer from progressive conditions such as Alzheimer's disease or terminal illnesses can be emotionally taxing. PCAs must be prepared to manage grief, stress, and burnout while maintaining professionalism and care quality. Support from agencies, peer networks, or counseling can be helpful for long-term sustainability in this field. Despite the emotional and physical demands, many personal care assistants find deep fulfillment in their work. The ability to make a direct, positive impact on someone's daily life, to restore independence, and to provide human warmth in moments of vulnerability gives this role a purpose that few other careers can match. In most cases, becoming a PCA requires a high school diploma or equivalent and successful completion of a caregiver training program. Certification requirements vary by location and employer, but many require CPR, first aid certification, and background checks. Ongoing training in areas such as dementia care, infection control, or mobility support is often offered by employers or encouraged for career development. As we near the end of this discussion, it's worth reiterating that the job description of a personal care assistant is not merely a checklist of tasks. It is a commitment to serve others with dignity, patience, and compassion in their time of need. Conclusion. The job description of a personal care assistant reflects a career rooted in service, empathy, and human connection. PCAs are a lifeline for individuals who struggle with daily living due to age, illness, or disability. Their work enables clients to remain at home, maintain their routines, and enjoy a higher quality of life through personalized care and meaningful support. For those who enjoy helping others, thrive in one-on-one settings, and seek a career that combines practical skill with emotional fulfillment, becoming a personal care assistant offers both a stable job path and an opportunity to make a real difference in people's lives. Whether providing a warm meal, a helping hand, or a listening ear, PCAs embody the very heart of compassionate care.